Welcome to Let's Be Heard, where we're turning whispers about women's health into powerful conversations. Every week, I'm going to be bringing you raw, honest talks with innovators and experts who are reshaping healthcare. From period problems to hormone mysteries, we're going to be diving into these topics you want to understand better. No awkward silences, there are no questions off limits, and especially no judgy vibes. Just honest dialogue about our bodies and health. Join us as we break down barriers, share stories, and create health dialogues that we wish we had growing up. I'm your host, Maddie Holman, women's health advocate and VC investor based in New York. Disclaimer, this podcast is intended to be informational only and not a source of medical advice. We aim to share stories, awareness, and resources available, but for any medical advice, seek out your provider. I am so excited to kick off this episode with a topic that is personal to my women's health journey, pelvic floor therapy. Now, if you don't know what that means, don't worry. You're definitely not alone. I didn't know about it until a few years ago, but it has been game-changing for my life and my health journey. So I am very excited to have on as my first guest, Carmy, the CEO and co-founder of Origin. Welcome, Carine.
Thanks so much for having me. It's a pleasure. And I'm so glad you're doing this podcast. It's really an important topic.
Yes, I'm so glad I was able to get you on. It really means a lot. I, for the longest time, had issues with going to the OBGYN. I would always dread going and getting a PAP because it was always so painful. And a lot of the time my pain was dismissed. And it took over 5 years to find an OBGYN who actually believed me, which should never take any woman that long.
Exactly.
So I'm so glad that you have created Origin to help solve for problems like that I faced with having a very tight pelvic floor. My latest OBGYN who's in LA, who was able to help, and she trained with Origin. So it came full circle. So I'm very glad to kick this off with you.
Well, I'm glad that you got the care that you deserve. And, unfortunately, your story is not unique. I think this is what I hear from so many of our patients, but it doesn't, dismiss the reality that like being in pain for 5 years when you don't have to be is just bonkers. So I'm glad that you're on a different path now.
Yes, I am so glad to. And I'm very excited for this episode to help others learn so they hopefully don't have to do 5 years of the journey that I went through. So would love to kick it off and just hear a little bit more about your women's health story and how that led you to where you are today.
Yeah. A lot of parallels actually to your story, Maddie. So I had been working in healthcare and technology for nearly 2 decades. And so in some ways, it's kind of wild that it also took me as someone who had so much privilege and access also about a decade before I finally got the care that I needed. This all started when I was in my 20s. I was living in New York. This was a while ago. I'm not going to date myself, but it was a different time. I think awareness has shifted, but I started experiencing pelvic pain and painful sex for the first time, really out of nowhere. I think it might have started with an infection, but I couldn't really tell what was going on. And I ended up at 6 different OBs, really trying to figure out what was the root cause. Someone did a biopsy, which was crazy in retrospect. I had imaging offered. I didn't take it, but I spent so much time, a lot of money, and I was just shuttled around the healthcare system. And ultimately they're like, try this cream or try this thing, and hopefully it'll go away. At no point during that time was I actually given a diagnosis or really a plan of care. It was just like, let's just try these things and experiment with your body. And so I kind of gave up, honestly. And I was like, I guess this is my sex life, which is kind of a sad thing to assume in your 20s. But yeah. I moved back to LA almost a decade later and reconnected with an old friend of mine from high school who just had a baby and was going to pelvic floor therapy on the advice of her friends who said, hey, we go to this place to fix our vaginas. You should go too. And so I was like, that sounds interesting. What is that? And she recommended I check it out and see if it would help with my pain. And so I went. And after 10 years, I had a diagnosis and I had a plan of care and I had hope ultimately. And I felt seen that there was someone who could say, you're not crazy. Like, this is real and this is really common, although a lot of people don't talk about it. 1 in 5 women have painful sex because of a, tight pelvic floor, whatever other kind of issues that are happening here. So that was so relieving. And then phase 2 was like 2 months later after my treatment, which was completely non-invasive and very much self-paced with, the provider support. I was healed and I haven't had, that issue since, even postpartum, which I was really expecting and kind of worrying about. And so we started really looking at the industry. I was like excited, but also incredibly angry that this was like, how did this happen? And why did no one ever tell me about my pelvic floor until this moment? And so that was like the beginning of the origin story, which I'm happy to get into. And, how we went from this, both of us having these personal experiences to seeing a massive need in this country. 1 in 3 women have pelvic floor dysfunction. It's probably much higher than that, honestly, but there was no really specialized network of providers who took insurance across the country.
Wow. Yeah, no, that is wild to me that it took 10 years and a
Yeah,
biopsy, like all this, and even not even a diagnosis. Like that's just,
crazy.
I'd say that healthcare is function that way and that it's not finding a root cause of that early on. And that it took to your friend saying, hey, we are going to help fix our vaginas to be like kind of that catalyst. I feel like that is so often how many women find
Yeah.
advice. And that's something, it's just very siloed. And like you only know unless someone either has
Yeah.
to go upon it.
Right. And I don't actually blame the doctors that I saw because at the end of the day, gynecologists and OB-GYNs are not necessarily trained in the musculoskeletal system and the different root causes that can create pain. Obviously, there's some reasons that you could have pain in your pelvic floor region that are related to your reproductive organs, which is what they're really experts in. It was a training gap. And then we have a history of bias. And, we can talk about all the reasons women's health is in the place it is today, the lack of data, the lack of research. But, they were trying to do the best they could. And I think luckily, this field of PT and really like pelvic floor therapy, and we think about it as more women's health PT overall, like the different ways that our bodies shift and change over time. We have different anatomical structures, different hormonal systems. Like we need to think about how do our bodies shift? When do we have pain and how can we use this really incredible non-invasive intervention to support us?
Yeah, no, and I love that an approach to and like reminding that yes, it's not us versus doctors in that way.
Yeah,
It's really just about education and awareness of new learnings and kind of amplifying that so everyone could benefit.
exactly.
Um, and so I'm really curious before we kind of dive into Origin a little bit more and what you guys do, just wanted to kind of cover a little bit of pelvic floor therapy and just pelvic
Yeah.
floor for listeners who may not be as familiar. So why don't you start off with like what does the pelvic floor actually do and why does it matter for us?
I mean, the pelvic floor is such an important part of our bodies, and it's kind of wild to me that we don't talk about this. And everyone has a pelvic floor, regardless of your gender. So just let's start there. But it is almost like learning about your back or your legs, right, for the first time, right? Like it's like this entire system of muscles and tissues and ligaments. It stretches like a hammock across your pelvis, and it is responsible for so much, including bladder and bowel control. So if you have incontinence, if you can't control your bladder, your bowel for whatever reason, that could be a pelvic floor dysfunction. It's responsible for sexual function, so pain and pleasure. It's responsible for lymphatic flow, holding up your organs. So there's a lot of relationship between the core and the pelvic floor. As if people take Pilates, they might have heard about before, or yoga, and so much more. And so it is this really kind of center of our body. And as women, we often also hold tension in our pelvic floors and our hips, and this whole area. And why we focus so much on the pelvic floor, but also the whole body around the floor, is that these issues can be kind of interdependent. You could have someone who's having chronic hip pain and it's actually pelvic floor dysfunction, or tailbone pain that's actually also related to pelvic floor dysfunction. So we have to look at the whole body system in the same way that my neck pain might actually be caused by, what's going on in my low back or vice versa.
Yeah. No, that's super interesting to hear. And it like, makes a lot of sense because there's not one part of our body that should be in a vacuum. They all work
Exactly.
together to make us function. And so I totally get that. It resonates a lot as you were saying that because when I went through pelvic floor therapy, I remember some of the initial things that my PT did was to put pressure points on the outside of like my glutes and things
Yeah,
like that. And I did not anticipate it kind of coming back to the front of my pelvic bone. I was like, whoa. And so
exactly.
it's wild to just like think, oh yeah, that makes a lot of sense. And how do we not know that that is all connected and that it's not just internal, it's external too. There's a lot of things
Exactly.
you can do.
Yeah. And, I think we can also talk about what is pelvic floor therapy because a lot of people might be afraid to kind of come in for a session. So I also think about like, what is the toolkit that physical therapists and occupational therapists use? And the first, and I think the most important healthcare intervention we have is therapeutic education. If you don't understand your body, it is clinically proven. If you do not understand what's going on for you, it is so much harder to heal. And the opposite effect is true, right? Like even when I think about, or when you finally had that moment of understanding what was causing this, the amount of like systemic physical relief you can get from understanding your body and understanding why this is happening is huge. And just on that note alone, we see higher rates of depression and anxiety among our patient population because pelvic floor issues are often so misunderstood. There's a lot of shame and stigma, but then also, it can really impact your life. And so just helping us understand ourselves, I think, is really step one of any healing journey. Step two is there's a lot of therapeutic exercise and movement that you can do that doesn't require hands on a body. And we can do that both in person and virtually. And then there's other parts of the toolkit, muscular re-education, all these different things that you can do, neuromuscular re-education that you can do to kind of rewire your brain and how it connects to your body. And then ultimately, if required, you can have hands-on therapy. But I think it's important to talk about that almost as it's not always required. It is very helpful. And I think it's really nice to get hands-on therapy. There's something really calming about it. That's why we have clinics. Like, it really works. But at least for what we treat, about 80% of our patients can have a fully digital telehealth program and have really good outcomes. And so I want people to know that, because when you have 1 in 4 patients or women experiencing a history of trauma or sexual abuse, the idea of coming in for a visit and maybe having someone do any internal work can be really, really scary. And so regardless of, whatever history you have, if you're coming in person, there can be weeks that could go on without you having any internal examination or support. And it's really very much self-guided and self-directed.
Yeah, I love that you called that out, that there's many ways to start looking at treatment and seeing what works best for you. I thankfully did not have any kind of trauma in that way, but
Yeah.
I did realize a lot of my pain and kind of tension was mental. And so it was
Yeah.
kind of unlearning that and like having to relax and like find ways to do that. I did it with like sound machines to kind of help calm and like
Yeah.
open noise. But like that's such a good point because there's so much of it that, you got to kind of crawl, walk, run as you
Hmm.
are kind of healing. And so
Yeah.
the virtual piece of it and that you can start and that there's ways to start is amazing, and I love that you guys provide both.
Yeah, it's the mind body connection. I mean, I feel like it's so obvious now, but it's still not obvious, I think, enough.
Yeah.
It's huge. And very similarly for me, the number one thing I had to learn was how to relax my pelvic floor through
Right.
diaphragmatic breath and dilators so that I wouldn't associate any touch with fear. Because it's almost like, you put your finger in the fire once and then you almost retract it before you even
Oh,
get to
yeah.
the fire the next time. And so the way that pain works, it can also be preventative, and that you're already experiencing pain before you have any kind of acute pain that's occurring. And that's often what can happen in a pelvic pain cycle.
Yeah, makes a lot of sense. And so I'm curious too, just understanding like what are conditions that pelvic floor therapy can help. I know
Hmm.
some people think of as pregnancy, postpartum, and also with incontinence when you're
Yeah.
older, but there are cases like you and I where it's tight pelvic floor, tight vaginas. Those are kind of the lesser well known. So I'm just curious, what's the range of conditions that could benefit from it?
Well, I think what is so amazing about this therapy, and I should say, I'm not a PT, I'm not a clinician, so I'm just obsessed and I need to make it, my life's mission to get this out to everybody, is that this impacts people through every stage of life. So you could be a teenage athlete who is a high performing athlete who has incontinence. So they're running and there's so much pressure on their pelvic floor that they're leaking when they're running, which is actually very common. You see it also in a lot of CrossFit athletes where you have bladder control around kind of high pressure, um, high athlete situations. You could be in your 20s and have endometriosis or PCOS or fibroids, and you could have pain associated with that. And PT is not going to solve the root cause of that pain, but it can be really therapeutic to support you. Obviously, pregnancy and postpartum is a very important moment that PT should really be embedded into the standard of care. And that's part of our big goal, is how do we work with folks to get the right postpartum recovery, whether you've had a vaginal birth or a C-section, but also during your pregnancy. The more that you can do to prepare for labor and delivery, the better your outcomes can be. And then in menopause, our bodies change again. 1 in 2 women in menopause are experiencing vaginal atrophy. So your muscles weaken. It can cause things like prolapse, incontinence, painful sex, obviously a whole set of other issues. You could have frozen shoulder.
Yeah.
And then, we age again and we are maybe experiencing osteoporosis or other issues. And so that's really kind of the full spectrum around pelvic floor health. And then if you think about women's musculoskeletal health, there's so much more that we can treat. And we're already doing a lot of that today, but we're excited to keep supporting women and, the full body care, because I think that there's no one size fits all approach to this. And taking a unique women's health lens, just given how differently MSK issues present in women, musculoskeletal health issues, is so important.
Yeah, that makes a lot of sense. I'm curious from your perspective and what you've seen
Yeah.
across those conditions and age groups. Is there more kind of awareness within certain groups or certain conditions, more ages, or is it pretty across the board, kind of scattered?
There's more awareness than there's ever been around the importance of pelvic floor therapy in a maternity episode. So maybe more postpartum. I think that's when most people hear about it, and conversations with your OB are changing. I think that, when we started this conversation, I talked about what happened to me in my 20s. It's a very different conversation with OBs. OBs are very happy to refer to pelvic floor therapists today, and especially they kind of get it in that postpartum moment. Also in France, it's standard of care. So in other countries we've seen, you get at least 10 sessions of pelvic floor PT after you give birth in France. Yeah. So we're behind, obviously, in the US.
Not
so I think that's changed, but interestingly, only 40% of our patients are pregnant or postpartum. And so, I think what shifted a lot in COVID is that people started really taking to the internet to search, to, really solving their own problems. And there's now like pelvic floor influencers on TikTok. And, we have so many people coming to our blog every month who are searching for these really what people would call, quote, niche things, but are actually so common. And so it's our job, we feel, as both like a public service to kind of combat misinformation around healthcare online, but also to help people understand their bodies, is to put out really great clinically informed content that can help people understand their bodies, and then if necessary, get to the care that they need.
Amazing. No, I love that. Yeah, it's definitely something I've seen a lot recently. It's like a good awareness, but also that comes with the other side of misinformation, and making sure that there's trusted sources that women can go to, because it's such a personal topic and experience for them to go through. So with that, I think it'd be great to dive in a little bit more on origin. What do you guys do? Where did you start and where are you today?
Yeah. So Origin today is the largest provider of women's health and pelvic floor PT nationwide. We've always believed in the power of hybrid care. So that means we love having in-person clinics when that's appropriate. And we now have 17 clinics across the country. And then we also have virtual care nationwide, which we started testing in the pandemic, but we really launched in a big way in 2023. And so at the end of the day, our business is all about getting folks the care that they need. What makes Origin pretty unique in our industry is that we take insurance. And so 96% of our patients are using insurance to get access to this care. The average out of pocket is around $22 per visit. And so, while there's no shade that I'm throwing against cash pay providers, because I understand why, if you're an independent provider, it doesn't make sense to deal with insurance. Like, I completely get it. And that's also what we saw in the mental health market for a very long time. I fundamentally believe that this is not going to shift the standard of care if it's a cash pay service, because most people just can't afford to spend a couple $100s a visit, and it becomes, a nice to have versus a must have. So from our very early days, we've worked within the healthcare system, and our goal has really been to change the standard of care and, help women feel their best through every stage of life. It's been a journey. I guess, how we've grown, we have been really just focused on both expanding where we treat and how we treat patients, but then also investing back in our team and our culture and our infrastructure, because one of the things we're seeing across medicine right now is just such high degrees of burnout and fatigue. And so how do we create a business that can support the caregivers? These issues are so intimate. There's a lot of emotional capacity that our providers are offering our patients, and we want to make sure that we have an infrastructure that works for them too.
They completely understand that. And it's so great that you do that, because at the end of the day, we need them so much in this industry, and they do deserve to have that work-life balance, to have that appreciation for what they do, because sometimes it's a thankless job, and they really deserve so much, because we all would not be able to have our lives the way we have it if we didn't have providers who were there to help make our lives better when things go wrong.
Yeah.
I love that you also went straight to insurance too, to make sure that it was covered. I'm curious how those conversations initially went. I used to be at Cigna Ventures, so spent some time on the payer side, and so I completely understand with you in terms of better to go through insurance versus cash pay. It's just a harder harder adoption overall. So curious, kind of like, what were those conversations like initially to explain why this should be covered?
It's really interesting because there are no specific codes for pelvic floor therapy. So we have to bill like a traditional PT provider. And if you've been to traditional PT, it's usually hour-long appointments, but you might only get 15 minutes with the PT, and then the rest of that time you're working with a technician or an aide, and they're kind of helping you with your exercises. Our model of care is so different. We have one-on-one 45-minute visits with the licensed physical therapist or OT or PTA. And ultimately, it's a different specialty. It requires a different approach. And we are obviously investing so much in training, and our providers spend a lot of money to get trained too. And so you have to kind of think about that. But there are no codes for this. And so we've kind of found a way to work within the system by helping payers understand this is the specialty. And usually they get it. Like, I don't think most payers we've talked to have been like, wait, what's the pelvic floor? Like, they kind of are a little bit actually more advanced, luckily, than the market, which is good. And, I think they understand the access gaps, because if you want to get PT for your pelvic floor or really women's needs today, you could go to a cash pay provider, which is about 80% of the market, or you can go to a hospital and wait 6 months to get care, which you might do that if you're having a surgery. But if you are pregnant or you're postpartum, or, you have pain every time you have a OB-GYN visit, like 6 months is not going to work for most patients. And so I think, are understanding the access gaps. Early days, it was definitely harder, also because we were a small, I think we're still probably small for some payers. Like, we're the biggest in the field, but we're still like tiny compared to other industries. And so we have to pack a punch in other ways, which we do through our outcomes, and really just showing the insurers, like, look, like my story, I have spent thousands of dollars getting unnecessary procedures done, when if I went to Origin on day one, like, it would have cost you a tenth of a fraction of that. That's not math, but you know what I mean. Yeah.
Oh, I completely do. Yes. It's nothing is better than the power of numbers and outcomes. So completely agree with you on that. And I'm curious too, from starting Origin to now, what's been the most rewarding part of your journey, and what has also been the hardest?
I think the people, and I was going to say patients, but it's really our patients and our team. So, I get to hear from patients all the time whose lives have been changed by our work. And I'm obviously, several degrees removed from that direct care. And so I can only imagine the impact that has on a provider. Like, if you look at our Google reviews, the phrase life-changing just comes up again and again and again. And it almost like can become trite over time. Like, no, this is truly a shift in someone's way of seeing the world and seeing themselves. Because if you don't feel good in your body, and if you are feeling prevented from dancing at your friend's wedding because you might pee your pants, or you can't have intimacy with your partner, or you've had such bad back pain for years and no doctor has figured it out, it will not only change your physical health, it'll change your mental health and how you show up in the world and your relationships. And so being able to change the curve in someone's life in that way, and seeing like the spark of hope, but then also healing, is just so powerful for me. And knowing that they're going to go tell their friends and their moms and their grandparents, okay, go deal with this thing because I dealt with it for too long. I mean, you're, starting this podcast in part because of your own journey, right? We feel we become evangelists when we've been blindsided by the system, and then all of a sudden can get healed. And so that's so powerful. And then getting to work with just an incredible team of people who are so smart and incredibly talented, but are also just kind and high integrity. And it's such a gift to be able to build the team. Worked with amazing people over the years, but now I get to choose who's around the table. And from our clinicians to our front desk to the corporate team, I'm just so grateful for the folks I get to work with every day.
And I can imagine just seeing all the lives that you touch and kind of experience. And it's just very fulfilling. And it's something I think we both kind of share, in that once you've had that experience and then seeing other people get that, it's just really amazing to kind of just uplift others and be like, yes, this is here, go and do it.
Yeah, exactly. Just here you go. I think to your question on what's been hard, one of our core values is stretch, which, I love. It's like the pun of being a PT company, but also, just like the growth mindset. How do you, get out of your comfort zone and be kind to yourself through that? And I think this role and this company has obviously stretched me in a ton of different ways. And I think at different points in my journey and my career, I'm like, oh, okay, enough of this growth mindset. I just want to have like an easy day where I like know what I'm doing. And there's obviously like ebbs and flows, the first year especially was so hard, launching the business and then having COVID. And we were only a four-wall business at the time and had to figure out how we would, retain our team and keep them employed. And the burden of that stress was really, really high. Luckily, at this stage, it's less existential and much more around operational problems, which I think are all solvable. You just need, time and great heads around the table.
That makes a lot of sense. And I want to switch gears a little bit to the industry
Yeah.
and some of the obstacles. I know we talked a little bit on this earlier, but curious from your point of view, why do you think pelvic floor health remains so overlooked in mainstream healthcare?
Yeah, it's a good question. I don't know that it's as overlooked as it was before because what I'm seeing in the data and what we see in our wait list, like we have hundreds of people waiting to get in, even in our most established market. So I think that the flywheel has started for awareness and education with every patient who comes in, like it has a loudspeaker. But from an industry standpoint, and why people might still say it's niche or what is your pelvic floor or whatever it is, I think there's a few things. So one, the lack of research. There just hasn't been enough systemic research on this field, and we're going to be trying to contribute to that in a meaningful way over the next couple of years. So we're really excited about that. But it's a data-driven industry, and once you have the data out there, it also can take several years for the industry to shift and move for this to become embedded in a model of care in a health system, let's say, so that every patient after they give birth has access to this kind of therapy. So I think there's some of that systemic data-driven gaps that we've had, which is very consistent across all of women's health. I think there's also these topics are historically not topics people want to talk about publicly. It's always in a whisper network where you talk about sex or poop or, leaking your pants or whatever it is. And I'm using that language explicitly, but it's real. And, a lot of employee benefits, which is sometimes how people are getting the kind of quote extra benefits. Like you can't really talk about these issues at work too. So they fit a lot of women's health fits into this bit of a no man's land that then people go online and they search for, jade eggs or whatever to try to solve these issues. But I'm not blaming women because the system has failed them in that way. So I think that kind of bias in research and data and then, the historic stigma are two big pieces. And then probably the last piece has just been around medical training. When we started the business, there were very few PT programs that had pelvic floor and women's health as a specialty track you can take. That's changed a lot. And so as you just think about the talent that's emerging from not even OB-GYN, but like PT school, now more and more people are aware of this. They're excited about it. They're choosing to subspecialize. So I think we're at the beginning of a pretty seismic curve in the industry.
And I'm so glad that it has been from like your experience of starting it to now that has started to change. And I'm excited to see more people kind of leaning into it. And on a more positive note, I'm curious kind of like, what are you most excited about innovation wise in this space?
Yeah. Well, I think one, there's companies going public like Hinge Health who have pelvic programs, and I'm just excited to see, large soon to be public companies talk about these issues at a big scale. So that's really validating. And I think regardless of the efficacy of the solutions or what they are, just having more and more information out there and more conversation is going to be net positive for patients and for the healthcare system. So I'm very excited by that. I think for Origin, what I'm really excited about is how do we continue to support patients across a care continuum? So whether that's in person or virtual, we'll be launching some things in the coming year to support patients who are maybe not ready for care yet, and how we can really just continue to offer just different pathways that I think have always been possible, but now with AI, we can be much more effective about getting folks to the right level of care that they need at any given time. So thinking a lot about kind of care navigation. And then, I do think AI is just going to be game changing for healthcare and for women's health. We are very bullish that in most cases always needs to be a clinician involved in a plan of care. And I think we probably take a different approach than some AI only companies, but women's health is so complicated. Patients are showing up with so many multiple conditions at the same time, getting to the root cause and diagnosing that. I just don't think technology alone will solve that. But I do think that there's a lot that we can use AI for to also support our providers, make their jobs easier, and ultimately get patients better faster.
That makes a lot of sense. And that's similar to how I view it too. I remember back when AI first came into the scene a lot, so many people were worried like, oh my God, it's going to replace doctors. There just can't be in certain circumstances, especially like you want, a doctor to still be in the loop. No one wants to do the administrative back of the office type of work, which AI is very helpful with.
Yeah.
So I really agree with you on how you see the trends with that going forward.
Yeah, and I think there's the back office admin support for both clinicians and, the, let's say, patient services team or the billing team. And obviously automating anything that no one wants to do on a daily basis is fantastic. So we're already focused on doing that. But I get really excited too around, how do we help providers also get more creative or leverage the power and the data of every patient interaction we've had before. So we're thinking a lot about providers on our team go to Slack today and they're messaging each other for tips if they have complex cases. Like, how can we help them solve that problem through technology? Just given, the IP that we have from all of the care we've provided.
Amazing. No, I love that. I
Yeah,
like getting quicker to diagnosis, helping treat women faster. And it's
exactly.
exciting to see how much data that you've been able to collect for that. So looking forward to seeing all that roll
Yeah,
out as
I
you
cannot wait
release.
to publish. It can't happen soon enough.
Well, definitely let me know when you do, because I
I will.
will be very excited to take a look at
Thank you.
it. So I want to finish out with some fun topic, really why I started this podcast in the first place, to have an unfiltered talk session about everything women want to know, but often are too scared to talk about. So start off, what's the biggest misconception you think people have about pelvic health that really needs to be eliminated
Yes.
from anyone's thoughts?
Okay, so I have a strong opinion on this, coming in hot.
Love it.
It
Love
is
it.
that everyone thinks the Kegel is the number one pelvic floor exercise. And so the Kegel is essentially this tightening and squeezing of your pelvic floor. Sometimes it's almost like imagining you're taking an elevator up. But it's actually not always helpful and can be harmful if you have a hypotonic or a tight pelvic floor. So in your and my cases, we probably were not recommended to do Kegels for a very long period of time. And so the number one pelvic floor exercise is actually diaphragmatic breath. It is almost the opposite. It's how do you lengthen your pelvic floor? How do you learn how to down train and relax, which can be beneficial to anyone regardless of their, condition. And so if you want to start doing exercise at home, practicing diaphragmatic breathing, and we have some stuff on our blog around this in a way that can activate your pelvic floor, can be really therapeutic and very relaxing.
In terms of sex, so how
Yes.
does the pelvic floor impact sexual health, and why is pain during sex often ignored?
Oh, good question. So in the case of painful sex, there's lots of different root causes of what can cause both painful sex or painful penetration. And I want to use that word thoughtfully, obviously from an inclusivity standpoint, but also like your experience. You probably couldn't use tampons, neither could I for a period of time. You might be uncomfortable in a pelvic floor exam at the OB-GYN. And so these issues can be caused by different factors. But, ultimately, one of the mechanisms that's creating that is this feeling of tightness in the pelvic floor and sometimes a bracing. I'm using less clinical language, but when you're almost bracing in advance of pain, because you are then, fearful of what can happen. And then any kind of sensitive touch can then create a triggered response around pain. And so there's some really helpful data and visuals around this on our website that, I'd recommend if anyone's experiencing that to look up kind of the painful sex pain cycle and what creates that and how the mind and body work in tandem there. But ultimately, as in both of our cases, you can work through this and you can heal. And I think, unfortunately, we're just, afraid to talk about sex in this country. Or, unless it's like either behind closed doors or in like very extreme ways. And so, I'm excited about normalizing that conversation around painful penetration because it can be treated in most cases. And then we can start talking about pleasure, like God forbid,
That will be another episode in the future.
Yeah, well, and the pelvic floor is very much not fully, but there's a lot of connection between pelvic floor and orgasm. And so how you can, if you're able to kind of release that tension, the strength of your orgasm, all of these things are deeply connected. And so, yeah, I would just say, let's start talking about it. I was not the person to talk about sex online. All of a sudden I'm like posting about sex on LinkedIn. So, if I can do it, we can start having these conversations.
I am with you on that. Probably to the point where I'm getting shadow banned on LinkedIn. Who knows? But, someone's got to start it. So I'm glad that I've got another person in my corner who's doing the same.
Amazing.
Awesome. And last one I wanted to touch on was in terms of leaking urine. We know this is a very huge problem for women. And often people either make it a joke or just say it's part of being a mom. How do you think the best way is to kind of shift this mindset?
Yeah. It's so interesting because we have normalized incontinence so much in this country. And obviously there's a time and place for panty liners and, adult diapers and incontinence products, but it's almost like because of the advertising messaging we get, that we assume that that's the only answer. Like, okay, you leak. I guess I'm wearing, this kind of underwear for the rest of my life. And doctors don't ask questions about incontinence, in a doctor's typical postpartum visit. And we're not being told that the medical system can actually help you solve that issue. So I think raising awareness of the therapeutic intervention that PT can offer is a really big part of it. It just anecdotally, I can tell you a lot of our patients will come in for other issues and then over time realize, oh, I can be treated for this here. Cool. Like, let's also work on that. We've just completely normalized that this is the way it has to be. But I think maybe the more that we start to tackle other parts of women's health and pelvic floor therapy, we can start to open the aperture around it.
Yeah, no, I love that. Any way that gets more information and awareness and help towards women, that's amazing.
Exactly.
One of the things I wanted to close with is, who else would you recommend that should be heard on this podcast that's doing amazing work in women's health?
Yeah. There's such an amazing community of women's health entrepreneurs right now. And so I'm like, how do I even begin to answer this question? I am obviously a big fan of the folks in the menopause space, like Joanna Strober from MIDI. I think what she's built has been amazing to normalize midlife care and also increase access to a wide range of therapeutics. So love Joanna. I'm a big fan of the teams behind Mavita Health and Seven Starling and Luna Joy, the folks who are focused on really kind of mental health with a women's health lens in mind, particularly around a maternity episode, which we know is so, so important given what we're going on, particularly postpartum, but in general. So I think those are the, couple areas I'm really excited about. And there's a lot of, I think, cutting edge science happening right now, which is a bit outside my normal wheelhouse, but diagnostics to help folks understand endometriosis or getting into some of these leaps and bounds ahead of where we are today, I think is really exciting. And then the final piece, more of a category that I'm excited about, is who are the companies and the people and the providers who are specialized in taking industries like cardiovascular health and applying a women's health lens, because these issues are disproportionately impacting women, particularly after menopause. And we need to be taking, a different lens here.
Really want to say thank you again so much for coming on and being my first guest.
I'm honored. Thank you for having me.
Of course. And I am excited for all the listeners to be able to learn more about Origin, hopefully reach out and see if they are dealing with issues with, pelvic floor, that they aren't alone in that journey and that there are resources. So thank you so much for coming on and sharing more about you and your company. I'm excited to continue to follow all your progress.
Well, I'm so happy to be here and I'm so excited to see how this podcast progresses and how you get to evolve this conversation. But thank you. And if anyone wants to get access to our free educational content, it's all at theoriginway.com and the same on Instagram.
Amazing. Thank you so much.
Yeah. Have a great day. Thank you, Maddie.
Thank you. And that's a wrap on this week's episode of Let's Be Heard. I hope you're feeling a little bolder, a little more informed, and ready to talk about your pelvic health without awkwardness or shame. If this episode spoke to you, share it with someone else who needs to hear it, because we are all in this together. Big thanks again to Carine Carmy for bringing the heat and sharing her journey with pelvic floor therapy. She's out here making waves, and I am all for it. Want to learn more about Origin and how pelvic floor therapy can change the game? Check out the links in the show notes. And hey, if you want to stay up to date on what I'm going to be talking about next, hit that subscribe button so you don't miss out. We're just getting started, and trust me, you don't want to miss what's coming next. I'm your host, Maddie Holman, and until next time, let's keep making noise and talking about women's health, because it matters.